Hello everyone, my YouTube name is Merce82, and in the following videos I'm going to be discussing the importance of having an advanced directive. I think many people know generally what this document is, but I don't think nearly enough realize just how important it is to have one. I'll be highlighting exactly why in a case study here. I'm a nurse, something you may have guessed from my YouTube account name. I work for a hospital, and I've been there now for 10 years. You take care of a lot of people over that period of time. After a while you forget a lot of the patients you've cared for, or at the very least they start to blend together. But a few will stick with you forever. This story is about one of those patients that stuck, and you'll soon see why. I came to work one day and was informed I was going to be giving primary care nursing to a patient who'd had an extended stay. There were family issues and other nurses had been fired. My manager wanted me and a few other nurses to take the lead in her care and not have the typical rotation of staff that can so often happen in a typical hospital setting. I walked into the room and was introduced to Alice by the previous nurse. Alice looked at me with a scowl. She was on a breathing machine and wasn't able to talk, but it was clear she wasn't happy. She acknowledged my presence, but little more. As I came and went into her room throughout the night, I grew very fond of her. I would sing "Row, row, row your boat," echoed by another person in the room, perhaps a CNA. When we were done with bed changes, brushing our teeth, feedings, and so forth, I would give Alice a high five. I talked to her about my family, my friends, and gave her a piece of who I was. I would get my iPhone out and play music from Pandora on it for her, which is an internet radio station. She shook her head yes and no to the stations she was happy or unhappy with, and I would leave them on the ones that she wanted. Every time before I left, I would lean down and give her a hug. The scowl she'd had earlier left her face, and for a brief moment, she seemed happy. Over the course of a few days of taking care of her, I slowly realized that Alice was quite bright. She turned in the direction I told her to when I was positioning her in bed. She was able to tell me when to stop on certain stations on my iPhone by nodding yes and no for the music that she liked. When she'd had enough of whatever it was I was doing, she would wave me out of the room with her hands, too. She was able to make her needs known and interact with me in ways most in her type of situation wouldn't have been able to. As time went by, I slowly saw Alice interact less and less with me. She stopped wanting to listen to music on my phone. She stopped giving me high fives. When I would start to sing, she would look at me and shake her head no, as if to say, "Please, I'm not in the mood." The day she pushed me away when I tried to give her a hug was a very hard one for me. I thought she was just going through a rough patch, that she would get over it if I was chipper when I came in the room. This only made her more upset. She just wanted me to get what I had to do done and leave her alone in her room. During the day, Alice was able to wear a device called the Passi-Mir valve, something that allowed her to talk for short periods of time. The day shift nurse explained to me she was upset with the treatments she'd been receiving during the previous month, and that she'd made that clear to her husband and to her doctor. But the doctor and her husband had determined that she was incompetent to make her own medical decisions and that they would continue with her treatments. One day I sat and talked with her. I asked her, "Alice, what's the matter?" She turned to me, tears in her eyes, lip and chin quivering. I reached down and held her hand. "Are you upset?" I asked. She shook her head yes. "Do you want me to sing?" I asked. She shook her head no. Then I asked, "Are you upset about the care you're getting?" She stared at me. After a pause, I asked, "Alice, are you upset because of the ventilator and the tube feeding?" She shook her head yes, and more tears welled up in her eyes. "Would you like to be taken off the ventilator and to stop the tube feeding, Alice?" I asked. She shook her head yes. "You know you would die, right?" I asked. She shook her head yes. "Are you ready to die, Alice?" I asked. And once more, she shook her head yes. Alice had undergone surgery, and as in all medical procedures, things can go wrong. With Alice, many things went wrong. Her heart and lungs had stopped working after the surgery. She had to have chest compressions. She was shocked. She received multiple medications to support her heart function. A breathing tube was placed and connected to a ventilator machine. Her kidneys had been damaged and weren't working properly. She wasn't eating, so a feeding tube was placed in her nose and down to her stomach to deliver nutrition to her body. Unable to be weaned from the ventilator, a tracheostomy was placed on her neck. This is when an incision is made about an inch below your Adam's apple, and a breathing tube is placed in your airway. She had a catheter placed to drain her urine from her bladder. Eventually, she developed a urinary tract infection from her catheter, and later pneumonia from her ventilator. She was placed on antibiotics. These antibiotics killed all the good bacteria in her gut, leaving an opening for a new infection to take place. Her gastrointestinal tract became infected with a bacteria called Clostridium difficile, which causes frequent, watery, green diarrhea. To be honest, there were so many things going wrong with Alice's body, I couldn't list them all. In spite of her suffering, her husband continued with her care. Nurses that disagreed with her course of treatment or stated what everyone knew, that this was not Alice's wish, nor was it in her best interest, were dismissed from her bedside and from her care. Almost all of us agreed that this wasn't what Alice wanted. Alice continued to receive treatment for an additional 4 months. Eventually, she had a mucus plug dislodge and block the airflow to one of her lungs. Alice suffocated to death. I can't tell you how many lives she touched before her death. I can say I grew to care for her a great deal. I believe she suffered for the last few months of her life. But her suffering need not be in vain. We can all learn from what she went through and take action. I know I can't answer all the questions people out there may have in this short video, but I do hope that what this woman went through can at the very least get people thinking and start a conversation. Ask yourselves, how far do I wish to go for life-extending procedures? Have I made my wishes clear to my loved ones? Are they on the same page with me? And most important of all, do I have an advanced directive?